morning early, so.
Did you text her, Jenny?
I didn't, but I will.
Oh, you mean on Senator Carson?
Carson
was that-
Rosenwald.
No, I think Todd was asking.
Oh,
Yeah.
so we did give 2 weeks notice in the calendar, but obviously you weren't a member. We didn't find out you were a member until very recently.
Right. All right. Are we live?
We are live and good to go, Senator.
Okay. Welcome everyone who is on this meeting. This is the organizational meeting of the Pharmacy Board. We are going to start with a right to know script, which I will pull down. And Jenny, stop me if I'm not going in the correct order, but I think I am. Welcome, I am State Senator Tom Sherman from District 24. Today we will be conducting a regular meeting for the Prescription Drug Affordability Board. Before we get started, I'll read through the checklist to ensure that the meeting we are holding is in compliance with the right to know law. As chair of the Prescription Drug Affordability Board, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12 pursuant to Executive Order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that number one, we are providing public access to the meeting by telephone with additional access possible by video and other electronic means. We are utilizing Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform. And the public has access to contemporaneously watch and or listen to the meeting on Zoom or YouTube and via phone by following the directions and links provided on the General Court website. Number two, we have provided public notice of the necessary information for accessing the meeting in the Senate calendar. Number three, we're providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email remote Senate, that's one word, REMOTESENATE at leg.state.nh.us or call 603-271-6931. Number four, in the event the public is unable to access the meeting, will be adjourned and rescheduled. Number five, please note that all votes taken during this meeting shall be done by roll call vote. Finally, let's start the meeting by taking a roll call attendance. When each member states their presence, please also state where they are and if anyone else is in the room with you during this meeting, which is required under the right to know law. I will call the roll and I'll start with Senator Carson, who is excused. Representative Merchant.
Here in Claremont, in my home, and my wife is in and out of the house.
Representative Murphy.
Here at my home in Hanover, and I'm alone in this room.
Todd Fahey.
I am alone in my home in Bow, New Hampshire.
And I am Senator Tom Sherman. I am in a home in Bethel, Maine, and also present in the house, but not in the room, are my wife and my son. So we'll go ahead and get started with the agenda. Just to review the legislation, I assume everybody has read through this. I've read through it about 12 times, and but there are to be 5 of us on the board. We Todd is going to be serving a term of 5 years. One member appointed by the President of the Senate, one member appointed by the Speaker of the House of Representatives will serve 4 years. And the next 2 appointed by the Senate and the member of the House of Representatives will serve 3 years. A simple majority is a quorum. and the chair of the board. We can have that election today, assuming we are all unanimous in our choice, because it takes 4 of 5 members. We do have alternates, although I don't believe all have been appointed. And we did try to reach one of the Senate alternates today to fill in for Senator Carson, but we were unsuccessful. This was very last minute absence. The meetings are noticed 2 weeks in advance. And the rest of this, I'm not going to go through this in great detail at this point. But what I'd like to do is I'd like to just go through, if you all will indulge me for a second, and ask the 4 members of the board here to share with us your background and interest in being a part of this. And why don't we start with Representative Merchant?
Thank you, Senator Sherman. My background, I've been a pharmacist for the better part of 30 some odd years, 3 decades. I've worked in various clinical aspects of pharmacy, from hospitals to hospice to community pharmacy, long-term care, and multiple avenues. The last 17 years were at the medical center in Hanover, at Hitchcock Medical Center. And in that capacity, I worked on several organizational boards within the medical center. Plus, I was also responsible for a lot of the pharmacy supply chain, also pharmacy activity among 17 hospitals affiliated with the medical center. My passion is in pharmacy and dealing with this whole arena. I spent a large part of it working in this space, and I do see a lot of benefit to what we're trying to accomplish. And hopefully I can take my expertise and my experience and lend it to the board.
Thank you. Next on my screen is Todd Fahey.
Good afternoon. So I am Todd Fahey. I'm the state director of AARP New Hampshire. I'm a lawyer by training. Before taking this post in early 2014, I practiced law for some 21 years in New Hampshire. I was most recently a partner at the law firm of Bourne, Reno, and Concord. In my role at AARP, this is an organizational priority of the prescription drug prices, because in many cases, granted staters are laboring under the costs of prescription drug prices. We were very actively involved with the passage of this and related legislation. And so we come to this with a keen interest in bringing down the cost of prescription drugs for consumers ultimately. And therefore, I guess I was appointed by the governor to sit yesterday in this role, and I'm happy to be here. So that is my background.
Great, thank you. Representative Murphy.
Good afternoon. My name is Jim Murphy. I live in Hanover. I've been in the Upper Valley here for about 40 years, but a New Hampshire resident for over 50 years. I am a recently retired orthopedic surgeon, having practiced at Dartmouth and at New London Hospital for about 40 years, and have obviously then been involved with many patients and the care of patients. As a practitioner, it's very acutely aware to many of us that the availability of drugs is not always okay or available for a lot of patients, either because of cost, in large part because of cost, and that in many ways will compromise the care of the patient. So whatever we do, if they can't get their drugs, the drug is no longer, it's not effective. And my interest is in specifically the affordability factor with prescription drugs in New Hampshire.
Great. And I'm State Senator Tom Sherman. I was a state rep from 2012 to 2016, served on Health and Human Services in the House. Then I had what I like to call my sabbatical year. And this is my second term in the Senate. Last term, I was chair of Senate Health and Human Services. And I was prime sponsor of this bill. And I think it's very hard to be in the healthcare arena. I'm a gastroenterologist. I've been in practice for over 35 years, still actively practicing part-time. And to be in the clinical arena and not almost on a, even more frequently than daily, almost hourly basis, be confronted with the system, the pharmacy system, and with medications for patients, writing prescriptions, prior authorization, all the above. So this has always been a big interest of mine. And I think, when we look at making healthcare affordable, you can't do that without looking at the system of not only developing and inventing new medications, but also how they are rolled out, how they're delivered, and how they're paid for. So I'm very excited to be a member of the board. I would just like to also let the board members know that Gary Merchant and I met earlier this week, wasn't it, Gary, with the chair of the main board. And that was to sort of, for me, to get a sense of whether we are on track and moving forward appropriately. And the good news is there is no specific track, but also that there's a keen interest in other states of pooling resources, sharing information, and really all of us getting smarter together. So whoever ends up being chair of this board, it's really helpful to know, I think, that there will be lots of support. So that moves us into election of a chair. And I would like, if this is okay with everybody, if there's no objection, I would like to nominate Gary Merchant, who is the pharmacist on the board and has that incredible experience in background. And so I would like to nominate Gary, and I've talked to him about it, and he would be willing to serve in that capacity. We will need a second. And if there's any of the other two of you who are really wanting to serve in that role, please feel free to speak up.
I'll second it.
Okay. This will need to be a roll call vote. Is there any discussion on Gary's nomination? Okay. So I will call the roll. So just for the record, Todd, we have, I made the motion, Representative Murphy seconded, and now we'll call the roll. Representative Murphy, how do you vote?
Yes.
Representative Merchant?
Yes.
Todd?
Yes.
And I vote yes. So that's 4-0. We have a quorum, and that's required by the statute that we have 4 people. Gary, I'm happy to turn this over to you. You have an agenda in front of you. The next step, and again, I just wanted to. The goal here, as we all know from our knowledge of the bill, is that we are going to have paid staff. And so I do not anticipate the role of clerk being onerous into the future. It's really just so that until we have paid staff, we can keep minutes of our meetings. And they do not have to be extensive. The meeting is recorded. So take it away, Gary.
Well, thank you, Senator Sherman. In saying that, the next thing on the agenda is election of a clerk. I think we had some discussion before about Mr. Fahey being interested in doing the clerk. Is that still the case?
I'm happy to do it, Representative.
I would move Todd Fahey for clerk.
I'll second that. Then, according to any more interest in the clerk's position from the folks on the panel? Hearing done, I'll move forward with the roll call. Senator Sherman?
Yes.
Representative Murphy?
Yes.
My vote is yes, and Mr. Fahey, sorry.
Yes.
Yes, it's unanimous. So we have 4-0. And I think the next question is what to do as far as further discussion. But the critical piece right now is trying to find a date for us to meet and put an agenda together, which I'll be more than glad to work with. And Senator Sherman, I'm going to ask you if I could possibly ask Jenny to help me. Or can I find some help somewhere along the way to pulling this together as far as coordinating the meeting and the announcements and so forth with it? Is that possible?
Right, it
We-
looks like Jenny
we
is
can do
saying,
that.
go ahead. Okay,
You can
Yeah,
do
Yeah,
that.
we'd be happy
what-
to do that. Representative Merchant, I did just want to draw to your attention that Henry Lippman has his hand raised. I'm not sure if you wanted to call on people but he does.
Yes, let's call in the
right.
Mr. Lippman.
Thank you, Mr. Chairman. I had connected with Senator Sherman about providing some support to the board here, as this is administratively tasked to the Department of Health and Human Services. He had asked if we could have someone today available for the minutes, and Nancy Plord, who works with me, is taking minutes. I'm here available, as is the Deputy Medicaid Director, Elisa Cohen, and I believe both Peg Clifford and Lise Ferran from the pharmacy unit are here and have been working on the part of the legislation that pertains to submitting for acquiring drugs from importation from that's required under the statute. And so I just want to let you know we're here to help and support.
Senator Sherman?
Yeah, I just wanted to be, first of all, congratulations to Todd for being elected clerk and then being completely off the hook immediately. That's awesome. Second is, I am just thinking about the discussion with Director Lippman, and unfortunately there were, it seems like there were two deadlines for submission of material prior to our organizational meeting. And our organizational meeting, of course, didn't have to occur till March. So I appreciate everybody jumping in, recognizing that these deadlines were coming and going. So I was wondering if it would be appropriate to ask Mr. Lippman if there's an update on, I think we had discussed a secure portal for submission of those reports for the companies that were doing them. Would that be appropriate to ask for that update?
I think it's appropriate if Mr. Lippman wants to address that. Director Lippman.
Sure, thank you. Can you hear me? I want to make sure.
Yes.
Okay. I was working with our Chief Legal Officer, Melissa St. Cyr, in terms of working to get this set up. I spoke with her shortly before this meeting. I don't have an answer yet. We're working on getting that set up. It ended up being a little bit more complicated than I think originally expected, but I'll be able to provide something to the board offline, hopefully the beginning of next week.
Thank you, Mr. Lippman. Also, for clarification, if I may, Senator Sherman,
Yeah, go ahead.
drug importation part of the bill, does that come under the Prescription Drug Affordability Board? I think it's separate.
No, it's separate.
Right, okay. Want to be clear about that.
Yeah, unfortunately, this got incorporated, as you may recall, into an omnibus. So it's a little more confusing, but we are just that one section under Prescription Drug Affordability Board. Can I ask a follow-up question of Mr. Lippman?
Yes, Senator Sherman.
Director Lippman, is it still the determination that Jenny should delete those emails and ask the sender to hold off until that secure portal is available?
Yes, and I think Jenny was going to compile a list of the addresses so that we could reach out to them when that secure portal is available for the submission.
Great. Great.
Senator Sherman, if I may, with Jenny's involvement and also to a certain degree with Director Lippman stepping to the plate to help out here, should we somehow try to look at what Jenny has on her plate to transfer that over to Mr. Lippman so we don't lose something in the transition?
Yeah, I think that would be appropriate. You know, Jenny is not. She has very graciously staffed this meeting and helped set it up. But this being just the organizational meeting, if the department is ready to take over on that front, I think a discussion between you and Jenny and whoever is assigned from the department offline might be the next best step to make sure
Sure.
that the transition is smooth.
Absolutely. That makes sense.
Well, thank you. Is there any further discussion that you wanted to have, Senator Sherman or Mr. Fahey or Representative Murphy at this point?
No, I think most of where we are right now is infrastructure related. And then, you know, whether or not you follow the lead of what they're doing up in Maine, which is to sort of do educational pieces for the board. That, of course, would, because it would be for the whole board, it would be great if we could get our alternates assigned. And then once the alternates are all assigned, we could have a meeting. We could start with that educational component with the infrastructure being done possibly offline between you and the department.
Mr. Chairman, I have a few comments too.
Sure. Mr. Fahey?
Yes, so a few things. So I'm delighted that Mr. Lippman's on the line, and I know we're administratively attached to Health and Human Services. I guess the question is, for me, in the first instance, as we're organizing, I mean, do we have an executive director? Because as I look at the charge of this body, there's a lot of work to be done, and I know we're looking out for deadlines on November 1st of 21. There's a few deadlines that are coming upon us. So it would seem to me that, you know, the structural components and how we're going to get about the work of the board and who is going to oversee that, you know, certainly it falls under our purview, but there's lots of mechanical pieces here, it seems. So I guess the first piece I have is the executive director piece, and whether we need such a person or whether Mr. Lippman in the first instance could serve in that capacity.
Mr. Lippman?
Yeah, I think that in terms of where I sort of see the role that I can play, given my Medicaid director responsibilities, is to, you know, if you will, get us to a launching point. But I think at some point, looking at the scope of work here, you are going to need someone, as provided in the legislation, to get all that stuff implemented. I think that's more than what we would be able to do in the Medicaid unit, but certainly we want to make sure that we support you to getting that position in place and getting all the other things that have to be done in order for you to function.
Senator Sherman?
I think that sounds like Todd has a follow-up first, and then I'll.
Thank you, Senator Sherman. Just a quick follow-up. So, I mean, do we need to speak to funding mechanisms now, requests for funding, so that given where we are in the budget cycle, we're assured that we're going to have a funding mechanism and stream in place to have what we need to do the work of the board?
I do think that that's something I need to follow up on. There is a provision for, fees to support the position, but I think obviously that's not going to be available immediately. But that's, if there's a decision that you want an executive director, which I would encourage you to pursue, then I can start to work and see what needs to be done to effectuate that. Senator
Sherman?
Yeah, this is just a segue on what Mr. Fahey was asking. We do have the capacity to self-fund, and there are many boards and institutions, as you know, in the state that do that. And I would see that as probably, making sure that we are able to self-fund and not a burden on the department, which is already overburdened, especially with COVID. But perhaps it would be something that could be worked on, and I believe this could be done by you as chair but we would have to get a determination maybe. But to work on a possible MOU with the department so that if they helped us at the beginning, we could pay them back with the appropriate funding mechanism through a fee structure. But, you know, at this point, I don't think we have an idea on what would be a reasonable salary and benefits. And that would probably, we would need the expertise of Chairman Littman and his team. And then when we know that amount, we could consider the appropriate assessment to cover that cost and be able to move forward with hiring as long as we have an MOU to pay back the department. Does that sound reasonable, Chairman Littman?
It does. Obviously, we'll work with legal and the department as well as with our human resource group and trying to get that in place for you.
So in saying that, thank you for helping out in that capacity. What amount of time do we allocate to the department to allow for the creation of an MOU and try to come up with some basic understanding what the cost will be? Because what I'd like to do is come back to the group here with a proposal, not just the MOU, but the funding proposal for it as well, for the board to sign off on, or at least review and to approve.
Do you have a sense you'll be meeting within the month? That probably would give enough time to do it. I don't know if you're considering something sooner than that, but given other things that are going on, I think that would probably be, you know, enough time for it to be researched and put together.
I'd rather try to do this and do it wisely than to do it. We do have to be sensitive to the timeline, but at the same time, be sensitive to the other demands on the department itself. I think a month is reasonable. I think I could even go for 6 weeks. The other thing which I'll be working on as well is looking at education. Fundamentally, is helping to educate the members on the board with how this complex system works or doesn't work, to have people grounded, if you will, in the appropriate information to help make wise choices and decisions going forward. So my takeaway from this here is 2 things. One is the educational component, and as well as trying to work with Mr. Lippman on a MOU and a funding possibilities, come back with the board for board review. Does that sound like a logical thing for the next agenda?
Does to me.
Does to me, yeah.
Is there anything else? I mean, that and by itself, I mean, the educational component is going to be important. Time-wise, it's probably going to take at least a half an hour, 40 minutes. So I want to be sensitive to people's time and allocate the appropriate amount of time for an educational component, and also have time to talk about an MOU and a funding source. The other thing which I was going to reach out to folks, do we know where we are with the advisory council, which is also in the statute, the creation of the advisory council?
Well, that, I believe that's up to us. So that would be part of, yeah, that could be on the agenda. I did not put that on the agenda this time because I felt that would be more appropriate to do once we had a chair.
Okay. So I have 3 things then.
Yeah.
That's okay. I just want to be sure I didn't miss something along the way. Thank you, Don. So is there anything else for discussion at this point in time that we want to talk about as far as what needs to be accomplished in the short term?
Just,
Yeah.
there's one other decision point that I don't think I put it on the, and I don't know that you need to do it today, but leaving some time for public discussion is maybe a good idea. Depending on what's happening during the meeting, having a public comment period at the end of the hearing or meeting might be a good pattern for us to get into. I don't know if you want to do that today, but I didn't put it on the agenda, but it is something that I think with the amount of interest there is in this process, it might be useful to have that public comment period.
Yeah, good point. Our people push for time because we have a little bit of time. I did set aside an hour on my schedule, but I'm not sure what other people have in their schedule. If we have the time, we could entertain some of the comments from the public I think it's going to be important to understand what their concerns are. So the points, Senator Sherman, their concerns are addressed along the way as well as ours.
Right.
Do we have time?
We do have time set aside. I think we blocked out a fair amount of time, so I think it's up to you how much time you want to open the window for public comment.
Can I call upon Jenny to help me out?
Yes, if she's,
Oh, absolutely, Representative. I'm gonna promote Senator Rosenwald though as the alternate. We were able to get a hold of her and she's graciously jumped on.
Oh,
you, Mr. Chair, you may want to have her introduce herself and where she is.
yeah, Senator Rosenwald, would you introduce yourself to the board and
Yes.
to the public?
Hi, Cindy Rosenwald, Senate District 12. I'm an alternate and I am currently in Nashua in my home. And I just found out that I should be hopping on here today.
Well, welcome to the board.
Thank you.
Would you mind giving a little bit of background about yourself and what your interest is on this board?
Well, this is my 9th term in the legislature. And I have served on both Health and Human Services over in the House and Finance. I haven't served on Health in the Senate, but I'm very interested in prescription drug affordability issues. And I was a co-sponsor of the enabling legislation last year.
Well, thank you for being a co-sponsor and welcome to the board as well.
Thank you.
I'm not sure exactly what you heard or did not hear, Senator. So far, what we talked about for the next agenda is an education to help people get grounded in the complexity of what we're dealing with and to frame it. Talking to Department of Health and Human Services about an MOU for an executive director and a possible funding source to support that, to sustain it. Next time, also talking about the advisory council and the appointments of people to the advisory council and having public discussion as part of the agenda. Is there anything else, Senator, you'd like to possibly add to that agenda?
I'm sorry I introduced myself from the wrong district. My ward used to be in Senate District 12 some years ago. I'm actually Senate District 13. And I think education is going to be very, very necessary. I don't think people understand if they pay a small copay that their insurer might be paying a huge cost. And what is the role of pharmacy benefits managers?
Definitely. Okay, Jenny, if we could open it up to public comments or public questions.
Sure, if anybody would like to offer any comments to the board, please feel free to virtually raise your hand, or if you're calling in by phone, to press *9. I've got crickets, Representative.
All right. Crickets are sometimes a good thing.
There you
So
go.
in saying that, then I'm not going to hold up the group here. I think we have pretty much outlined the agenda for the next meeting. I'll work with Mr. Lippman's office to try to find a way to schedule the next meeting with everyone, and then work our way towards a date that works for as many of us as possible. With that, then I'll take a motion to adjourn.
So moved.
Second, please.
Second.
So we have a motion to adjourn. Roll call. I'll look at Mr. Fahey.
Moment of discussion before we adjourn
Sure.
or act on the motion. I do think the statute anticipates all of us signing conflict of interest statements, particularly given the importance of this. So we might want to consider that as an agenda item. I'm sorry I didn't raise it earlier. I tried to.
It's a good point. Senator Sherman?
Yeah, that might be something that we could ask Director Lippman to see if Melissa Sancerre has a template for that process. It may not, since it's a requirement, I don't know if we need to review that, but if the department has a conflict of interest form that we can fill out I think all of us who are in the legislature have already done conflicts of interest, but this is a very specific one, so it might need to be more extensive than that. That may not take up much agenda time. It's just that we need to sign them and get them filled out. So if Director Lippman would be willing to check with Melissa and see if they can produce an appropriate conflict of interest for the board, that might be that simple.
Thank you. Is there any other discussion before we move on to the motion to adjourn? Hearing none, I'll call the roll call. Mr. Fahey,
Yes.
Representative Murphy,
Yes.
Representative Sherman,
Yes.
Senator Rosenwald,
Yes.
Representative Merchant votes yes. With that, we have unanimous vote to adjourn. So I want to say thank you for taking your time today, for those in the public as well. And we'll reconvene sometime next month.